Thank you so much for joining us today. We are welcoming Jana Tanner with Physicians Choice Home Health as our guest to learn more about how home health and home care collaborate and work together. We have very similar goals, which is to encourage safety and encourage recovery, to reduce the risk of falls or re-injury, and to prevent hospitalizations or rehospitalizations. And so, Jana, thank you for joining us today, and we're really looking forward to talking more about how we work together.
Thank you, Karla. Thank you, Andrew.
Yeah, our pleasure. So, Jana, I just want to hit the first topic of what is home health care and home care. And there's so many different terms used for both. Sometimes it's confusing when somebody is coming home with home health care to understand what that means, what you do, and then the differences of our teams and how we work together. One of the ways that I kind of differentiate that a little bit more is I think of home health care as skilled nursing and therapy, and home care as private duty care. What are your thoughts on the confusion? Do you see that very often?
Yes, I actually see that almost every time I talk to a patient, and I differentiate it very similar. I always come out and explain to the patient that a skilled service is with physical therapy, occupational therapy, speech therapy, a registered nurse, and which would include a bath aide if they have a skilled need. And that the home health care companies, such as Home Care Partners of Nebraska, is a non-skilled company, and they take care of everything that we don't. So they collaborate very, very well together.
Like a real life example that I remember of like how to explain what that looks like. So a gentleman that I'm friends with, he had therapy, and they moved to town, and his wife was still really busy, and he's semi-retired. And when he was coming home from therapy, they had their home health care set up for his therapy after his inpatient stay. Got into their garage, and then he was trying to think, I don't even know how my wife is going to help me get from this car up the steps into my home. And then as they're talking through that, then he's thinking, well, she's going to be gone every day, doing her thing, and I'm here and I've got therapy going on for a while, so who's going to be helping me to do that? And so they just kind of struggled through that for weeks while they went through his recovery. When I was asking him about it after the fact, and he's like, gosh, I didn't even, we didn't talk about that enough as I was doing my discharge, and just didn't even know what home care was, private duty. I thought I got everything that was available, and didn't know that there was something else there, because that would have been really helpful. So that's maybe a good real life example of, you've got your therapy, that you've got your visits during the week. And I think of my own family too. My grandmother, a couple years ago, when she had a joint replacement, she came home and my family was just kind of rotating through who was over helping her, but not understanding, I guess, what's available and what those differences are really helpful. So thanks for explaining that, because it's confusing. If you haven't done it before and nobody tells you what it is, you never get to know.
Absolutely. And like you said, unless you've used it before, you really don't know the differences. And people are all the time confused by the fact that they think that when we come in, we might be there all day, or they think we're going to be there for hours at a time, and they don't realize that we're there for like 45 minutes and that's it. And that's when we need you to come in and help us with that patient.
Yeah.
What I love about working together, Jana, your team has been so excellent and provide that continuity. So when we're working together with a discharge, there might be somebody that starts therapy, for example, and the caregiver might be observing that physical therapy session, and the therapists have just been so excellent to not only go through a routine and go through the why it is that we do these certain exercises and how that helps the patient, and that's kind of tailors to that person-centered care. Every program, when we work together, has been very customized and tailored to the recovery needs of that individual. And when they continue, when that therapist leaves, and they may say, I would like you to do these exercises twice a day or 3 times a day. and being able to help them so that not only are they accountable and that they do the exercises, but they do them safely, and just how much we've seen that expedite a recovery process. And I really appreciate your team working with us and working with our care manager to set somebody up for success.
Well, thank you, Karla. We really appreciate the collaboration that we have with you on that as well. I was just speaking with the owner of our company yesterday, and I mentioned your name and how well we've worked in collaboration with you, because now more than ever, especially since the PDGMs have changed with Medicare coverage for these patients for their physical therapy, occupational therapy, and how instrumental it is that we can review with you and walk you through their physical therapy and their occupational therapy so you can continue those services once we are required by Medicare to discharge that patient as a patient of ours, and then you can take over. And as you mentioned, that's instrumental in that patient becoming 100% well and getting their total life back.
What do you think about time frame? Oh, excuse me.
Yeah, I was going to say, one of the newer families that we started serving a couple months ago, it's kind of good to see what that progress is like. When Karla and I might be meeting with the family at a time of discharge, if it's a spouse, somebody's maybe in some pain and they're going through therapy and they need a lot of help. It's really cool to be a part of that process. And they called a month and a half later to talk about something else and how are the rest of things going. To say, her husband had gained so much strength, and the combination of the therapy plus we're there every day helping to do those exercises was just such a cool thing to see from the start of when we might be working with families, very difficult and stressful and not knowing what's going to happen, to just most frequently we have that type of story where the recovery might end up being quicker than you expect, and your life gets back to what you would consider normal faster, which is just to get to have success stories like that so frequently, so great.
And that's why we're in this business, isn't
Yeah.
it? Mm-hmm. Yeah.
So Jana, I know one of the questions that we get a lot is about time frames and how long their therapy will come. How do they know they've reached their step goals or a progress report? What does that look like when your team's communicating with the family and with their care teams of reaching step goals and determining how long service will last?
Well, one of the big keys is just making sure that that patient is seeing progress, because if they're at a stalemate and they're not getting any stronger or any better and they're not making any progress, then it's hard for us to stay in service. It's a Medicare requirement that we have to see progress with that patient. And then it's very individualistic to the patient too, as far as what their diagnosis is. There's a lot of factors that go into it as far as how Medicare pays for that and how many visits that they get. A lot of times is dictated by the physician as well. We can recertify a patient after a 30 or 60 days. If it looks like that patient is still seeing progress, then we can have them recertified. So there's kind of several things that factor in for that.
Sure.
Yeah.
So with making progress, whether somebody is discharged from a rehab, whether they go home to a residential area or to a community, what does your team see as far as healing at home and a home environment, and what sort of benefits, I guess, would you talk about when you think about recovering at home?
Well, we think it's huge. We find that people recover so much faster when they're at home, when they're sleeping in their own bed, they get better rest. When I talk to people who, especially if they've been in the hospital or if they're in a rehab facility, they really go home exhausted, and they are so amazed after being back at home in their own bed and just getting a good night's sleep, what a difference that can make. And it's huge for us because you can imagine it's pretty hard to endure physical therapy or any type of recovery when you aren't well rested. And so that is really huge to be at home.
I'm glad that providing that therapy in home is an option when it's the right option, because there's kind of a misconception of a lot of people when they're getting ready to go home, maybe from the hospital, that they think once I discharge from here and I get home, my life will go back to exactly what it was before I left. And that's not always the case, is it?
No, and I have a mother that's 85 years old, and you both have met her because you've taken care of her. And I just saw firsthand how important it was after she had her surgeries and then went from the hospital to a rehab and from rehab to home, how important doing homebound physical therapy, occupational therapy, and then having your company come in and help her bathe and help make sure that you helped her with meal planning, because that's important too. They need to eat well. They're going to eat better, well-nourished meals when they're at home, and especially if they have your help in making those meals and help in getting those groceries at the grocery store, which I know is another service that you provide. So all of that comes together to make the perfect storm for a patient to recover and get their lives back.
Was your mom one of those persons that thought as soon as she got from rehab to home that things are going to get back to normal pretty quickly?
Yes. Well,
Yeah.
They always hope that, don't they? They always have higher hopes that they're stronger than what they think they are. I think they are always surprised by how weak that they've become when they haven't worked out at all or had any type of exercise and they've been laid up in a bed. It's just a huge decline. Even 2 weeks, you can see significant decline.
That's been quite a while ago, but I remember, so our team, when your mom was finished with her therapy and she was able to get out a little bit more, our team just talking about how important it was. She has a couple of drive-throughs that are her favorites.
Absolutely.
And so they had so much fun being able to say, like, here's really small things that make this huge difference.
And it just made such a difference in her mental health to get out of the house and just to be able to go for that car ride, let alone the bonus of being able to go through a couple of her fast food places that she loves and hadn't been able to eat in quite some time. But just to see the trees and the road and the sun and that did a lot for her mental health. Yes. So thank you.
Good. I know we're doing a lot of that right now with all of the families that we serve that can get out, because if we can get out for an hour or a couple hours a day and go do something safe, it's a lot better than staying inside all the time. A lot of mental health work that we're doing right now.
I think with the coronavirus, we've all found out how it's very difficult to stay home. Even when we are healthy and we're able to physically do everything, it's still really hard to be told we have to stay at home.
That's a very good point. We're kind of maybe putting ourselves in the shoes of someone like that. You kind of feel how your mom felt when she was at home.
Exactly.
So as we're caretakers of our parents, and if somebody may be a caretaker for their parent at some point in the future, if they're not now, but just kind of think about how that feels, and that would be what your parents are going through. So it's a great reason to work with some different resources that can help parents to get out and keep them doing well.
Exactly.
Jana, as we wrap up here, I know a lot of people have put surgeries on hold this last quarter, and now we're starting to think about and starting to get those surgeries scheduled. What advice would you have for them going into surgery, and when would be the best time to contact you for next steps after surgery?
Well, I think it's a good idea just to stay moving as much as you possibly can before, just for good circulation and keeping up any type of muscle mass that you possibly can. Going into surgery is always the best way. You're going to recover a lot faster if you do that. And I think it's a great idea to know, even before you go in for surgery, who and what services that you're going to need before you even get to the hospital, so that when you're there, you already have your decisions made. It's hard to make decisions when you're tired or you're in pain or you just don't feel good. So I think it's always best to have all of everything planned out. And if you call your company and our company ahead of time, and let us know that that's your desire to use us, we can already start processing and have people on standby Our model is similar to yours, where if we have a physical therapist that comes in, we have the same physical therapist that comes in each and every time throughout their treatment plan. So to have some heads up on that is really helpful for planning staff.
That's great advice, Jana. Thank you for being with us today. We are so proud to have the opportunity to work with your team. It's a fantastic team with a great reputation, and I think every single interaction somebody has with you is such a blessing. Thank you for all that you do in the community.
Oh, well, thank you for all that you do. You're very imperative to have in this community, and we're blessed to have you as well. So thank you very much for your time.
Thanks so much.
Thank you. Bye-bye.